work for the anaesthesia department at Waikato Hospital, and the research that we're working on is trying to understand how general anaesthetics make us go to sleep. It's a lofty goal, it's a challenging goal, but it's a very important goal. In about 1 or 2 cases out of 1,000, when a person is supposed to be asleep under anaesthesia, they're actually aware. And it's impossible to predict who these people will be, and it's impossible to prevent. When these people are paralysed, they have no way of communicating with the anaesthetist that they're actually aware of what's going on. It's a big problem. And the reason that it's an issue is that we have no way of actually measuring whether a person is awake or asleep. The particular research that I've been involved in is trying to understand how anaesthetics affect the spread of electrical activity across the brain, in particular looking at the cerebral cortex. So the cerebral cortex is the outer kind of layer of your brain, and that's where consciousness is produced. And what we've found is that different anaesthetics of different classes, so drugs that actually have different effects at the molecular level, all have in common one thing of reducing the connectivity between different brain areas. And we think what this is doing is telling us something really important about how the brain is making us conscious and what anaesthetics are doing to cause unconsciousness. If the brain areas aren't able to communicate properly, then the cortex is not able to actually build the picture that's necessary for consciousness to occur. And if a person is paralysed, which is common for surgery, and they are aware, the anaesthetist has given the amount of anaesthetic that they think should be enough, and usually would be enough to keep someone asleep. But in this particular case it's not. That person has no way of communicating that to anybody. So they go through the operation and come out the other side, and then they have some recollection of their surgery, which is obviously, that's not something that we want to have happen.